Yeah, I think that there's been, it's changing. There's been an over-selection of patients in the past. Since the positive trials came out, there are some centers that there's some centers that stick very strictly to the inclusion-exclusion criteria, and that basically causes patients that could potentially benefit to just not have the treatment. The way that you choose a patient in clinical practice versus if you're enrolling in a trial is inherently different. And so your bar for efficacy is different. And so the patients in those trials were really selected to prove that thrombectomy is beneficial, and they had number needed to treat of 2.6 in the Hermes analysis. So it was a pretty high bar, and that means that there are patients that were randomized to medical management that probably would have benefited from treatment. So I think at least in academic centers or in centers with interventionalists who believe in stroke thrombectomy, we don't stick very closely to those inclusion-exclusion. We kind of use clinical judgment and may include patients that have some disability at baseline, for instance, where they would have never made it into the trial, but there's no reason why they wouldn't benefit from the treatment. So I think there are trials addressing, future randomized trials addressing the kind of, as we discussed in the controversies, the kind of gray areas, but I think it's just more education and having everybody on board.